The correct terminology is actually human patient simulator, and these are high fidelity human patient simulators. Fidelity is essentially making it as lifelike as possible. So simulators come in two large groupings. One is low fidelity, less lifelike, and high fidelity, more lifelike. The closer to real life that you have, the better really for most standards. So specifically it has to do with how they're designed. So these are designed primarily to be able to mimic a human body, and so the physiology of the simulators that are the high fidelity models we have the same physiology characteristics that humans have, that we all have. And the pharmacology, or the way the drugs are programmed, is accurate in terms of it's called pharmacokinetics of the programming is accurate, and the dynamics are representative of as well what would happen in the body. So if you give a drug, it will respond in a way that that drug would respond in you. And so there's a lot of issues with, as you can imagine, in medicine where you don't always want someone practicing something for the first time on a person, on yourself. And so this makes them ideal, particularly for practice skill sets like placing an IV, for example, in nursing, or even something as basic, however, as learning to auscultate the lungs, where to put your stethoscope. But also when it comes to, for example, again, giving medications and drug effects, we do a lot with that, teaching students the basic pharmacology of a substance and the effects, so cause and effect. We have currently 6 current simulators, and they are different sizes, just like any human really. So we've got adult simulators, and the adult simulators primarily are all the same size. They are technically interchangeable, where if you decided you wanted to do a case with a female patient, you could interchange the parts, so to speak. Pediatric model, we have one of those. It's about a 5 to 7-year-old child, and the baby is approximated to a 6-month-old. Also program disease states, and so there's a lot of disease states that these allow a student to observe, and that's really where some of the utility comes in that we can't get otherwise. So for students early in their career, especially so in their first or second or third year of school, where they're not out in practice yet, but it would be beneficial for them to see, well, what does a patient look like? Pretty unique. We're one of the only colleges of pharmacy in the country to have this extensive simulation center. We were actually one of the very first pharmacy colleges in the country to even get a simulator. This is back in 2001. We're well known for that in terms of the national stage. And so that's been certainly something the university has capitalized on.